Hello, yet another video. Okay, this video of the kidney, we're going to be focusing on the blood supply of the kidney. Because the function of the kidney, of course, is to filter blood. We need to have a pretty good understanding of blood supply to the kidneys, and that drives its function, of course. So let's start out here. The major artery that is feeding the kidney with blood is going to be the renal artery. And the renal artery, as it enters through that renal hilum, right, that space here, is going to branch. And as it branches, each of these major branches that leads off to different portions of the kidneys is called the segmental artery. So let's kind of move in a little bit on this. You can see this out here is going to be portions of a segmental artery. The segmental artery then branches to go in between each pyramid, in between the lobes of the pyramid. So we call it the interlobar artery. Okay, the interlobar artery. Arteries are here in red. So traveling in between the lobes of the interlobar arteries. Those are now going to arch over the top. They're going to arch over the top of each pyramid. And arch in Latin has to do with arc. So these are called arcuate arteries. The arcuate arteries, and you can see it over here as well, right? These segmentals down here, interlobar, now arch over the top of the pyramid. So these are now going to be called your arcuate arteries. And then you can see how the arcuate arteries all branch off to go out towards the capsule. They're going to move through the cortex, the renal cortex. In other words, they're going to radiate out through the cortex. And so there's a couple of terms that professors use to help you study these, or a couple of terms that professors have you guys learn. And one of them is called the cortical radiate arteries. And that's the one I prefer because it helps us understand what it does. They radiate out through the cortex. So cortical radiate arteries. The other term that they use is interlobular. Interlobar down here, interlobular up here. So you can use that term as well if you so choose. And the way it works now can be seen over here. So now we have these cortical radiate that now radiate out through the cortex, and each one of these is going to end up kind of branching. See it pretty well here. Each one of these branches. And as it branches, it goes to one of these little capsules, these little balls right here. And these are called renal corpuscles. It's inside of these renal corpuscles that we end up finding the glomeruli, right? That is where filtration occurs. That's where we find the beginning of the nephron, which is the functional unit of our kidneys. So at this point, when the cortical radiate branches, we're now small, and the smaller the arteries get, we end up starting to make arterioles. So here, this little branch that moves out towards that renal corpuscle, that is a afferent arteriole that is going to be feeding blood to each glomeruli. And what makes arterioles, right, not an artery, an arteriole, these are the smallest of the arteries. What makes them so interesting is they're surrounded by smooth muscle, and this is where we can start to regulate blood flow in and out of this renal corpuscle. The more blood that enters, the better our filtration can be, or we can start to decrease the amount of that filtration by causing vasoconstriction of our arterioles. So we want to be able to direct blood flow by changing the arterial diameter. Now, we want to look a little bit more at the nephron before we continue to understand our blood supply. But unfortunately, with this particular model, we don't have that much of a choice except to come over here. Okay? And this still isn't perfect because of the way the video is. But what you guys can see, for instance, on this side, is that this is one of those renal corpuscles. And when blood gets filtered, it's going to go down through this gigantic loop down here. It's going to go through a PCT, proximal convoluted tubule, into a nephron loop. which then goes into the distal convoluted tubule. And this is where we have reabsorption occurring. All the reabsorption, we filter like 180 liters of blood a day. That's 92-liter Coke bottles side by side in a grocery store. And you do not pee 90 liters a day. In fact, you only pee about a liter to a liter and a half a day. So even though we filter 180 liters through all the nephrons, through all the glomeruli of our body, most of that is going to get reabsorbed through these loops. And when it gets reabsorbed, it's going back into the blood supply. So if we reabsorb here in the nephron loop down inside of the pyramid, it's going to go into this capillary bed down here, which is called the vasa recta, the vast, straight capillaries. Recta means straight, vasa means vast. The vasa recta. You can see they're big, straight capillary beds down here. And if blood gets reabsorbed up here in the cortex, it's going to go through a capillary bed that wraps around it called the peritubular capillaries. Okay, so the peritubular capillaries are the capillaries now that wrap around the tubes, which you can see on this particular model over here. Peritubular capillaries wraps around the tubes, and that's going to allow for the reabsorption of material back into the blood, whereas the vasa recta wraps around these loops that you see down here to allow for the reabsorption of blood. And from there, all of that blood is going to return back. It's all going to return back, and it's either going to return back to the arcuate vein, or it's going to return to the interlobar vein. Either one, just depends on where it feeds back into the system. And then it's going to go interlobar back down into the renal vein. There is, to my knowledge, no segmental vein. I could be wrong. I'm not a total expert on the venous supply or the venous return out of the renal system, but everything that I've searched for says there is no segmental vein. So that flow chart would go like this. We'd start at the renal artery, segmental artery, interlobar artery, arcuate artery, cortical radiate arteries. We now have filtration, and blood is going to return, filtrate's going to return back to the blood either through the vasa recta or the peritubular capillaries. Depending on where they return, they're going to return most likely into the arcuate veins and interlobar veins, and then end up leaving the kidneys through the renal vein. And that's the blood supply to the kidneys. I will also try to put a flowchart YouTube video up. I'll make sure that I label it as flowchart so you guys can search for that as well. Best of luck with your studies. Always be nice to one another. Till the next video. See ya.